Hi, I'm Mina Malik Hussain and you're watching The Coffee Table, and today we're going to blow your minds in a bad way. Because I didn't realize this, but Pakistan has one of the highest incidences of stunting in children in the world. And according to the UNICEF, 38% of kids in Pakistan right now are stunted. And this is a massive problem. And it's also a very complex and multi-layered and sort of surprisingly complex problem. And when I started reading about it, I was really surprised. And I'm pretty sure you guys will be too. But happily, we have a lot of experts on board who are aware of this problem, and the government is working really hard to contain it, but I'm still curious. So joining me on set today is Dr. Spenta Kakalia, who is a consultant pediatrician, and Dr. Naeem Zafar, who is also a pediatrician. So yay, they know about kids. We're going to ask them about stunting today. Hello, doctors. Welcome to the
Hello. Thank you.
It's very lovely to have both of you here.
Thank you for having us.
Yes, and now, sort of because I've been reading about stunting, and I'm just completely gobsmacked, but let's, as I like to say, begin at the beginning. But what is stunting?
Okay, so that's a good question. What is stunting? So stunting is a child who is short for age.
Right.
So
So not a dwarf.
no, somebody who is born appropriately, and because that child does not get enough calories, so either food in enough quantity or with enough calories in it, or has so many infections that they cannot overcome that, then their height, so they lose weight initially and then their height suffers. So you have children who by the age of 2 will have decreased height for age, and these are stunted children.
Okay. So Dr. Zafar, there's obviously a difference between stunting and dwarfism. Now, what is that difference?
Now, let's talk about stunting first.
Yes.
Dwarfism is actually a short stature because of any pathological reason or any medical reason.
Okay, so
But
that's just a completely different thing altogether.
Well, yes, maybe. But what I want to tell about is about the stunting is that when we talk of stunting, it is not just the short stature.
Right.
When we are taking it as an index of something, we are actually talking of malnutrition per se.
Right.
And malnutrition, what happens when a child does not get enough food? When the child doesn't get enough food, he tends to shrink. His growth falters. His weight doesn't increase. Now, at this moment in time, in Pakistan, 1 in 8 children are so desperately thin or underweight that they can go into any kind of infection and death very soon. Now, the worst part is when this continues and on for years, then not only their weight suffers, also their height suffers. So when we talk of stunting, we are actually talking of malnutrition spread over the child's lifetime.
Okay.
And that is why it is of more importance than just talking about it as dwarfism or as it's an index of malnutrition spread over years. So this hasn't come about in a day.
Yes.
And more importantly, when the children are stunted, they are host to a lot of risks for death. You'll be surprised to know that at this point in time, if there are 6 million deaths of children worldwide in a year, half of them, 3 million, are attributed to malnutrition. Because of malnutrition, because of decrease in the body defense mechanism, due to malnutrition, the children succumb early. The infections which probably you and I will catch and get away with, the young children will get it and they may suffer for a while, but a malnourished child can actually get into serious infections and they have a chance to die.
That is shocking, because when I hear malnutrition, that sounds to me like something that is entirely preventable. And I keep sort of talking about dwarfism in my layperson way, because stunting is not something that it's not something you can inherit genetically, and it's not a kind of, sort of malfunction of your, in something that you can't help. But malnutrition is something that can be helped, and it's utterly preventable, which means stunting is preventable.
So absolutely, malnutrition is what seems like a very basic, right for every human being and certainly every child is to get appropriate nutrition. And if you don't get this appropriate nutrition, then you end up malnourished.
Yeah. So malnutrition is also quite a sort of multi-pronged thing, isn't it? Because then malnourished mums have malnourished babies, and then those kids grow up, and then, like you said, that cycle of undernourishment continues, and then they in turn then have children who will be weaker, and sort of so forth. So sort of where does one then begin addressing, let's say, malnutrition?
So it's absolutely right. It's not a genetic link, but yes, a mother who has been malnourished herself, if it was chronic, went on for a while, a stunted mother will probably give rise to a low birth weight child, and the vicious cycle continues. So I suppose the way to stop it is, is to address all the problems, which are really multifaceted. It's not an easy answer of how to stop. It seems very easy, feed the child appropriate food and we'll have fixed the problems.
Well, I guess the best time to intervene is when a girl is an adolescent.
Okay.
Because an adolescent girl, if has a proper nutrition, then the moment she enters into pregnancy, she has some reserves.
Yeah.
When we talk of malnutrition, nowadays we are talking of the 1,000 days.
Yeah.
And by 1,000 days, we mean 270 days inside the mother's womb. And then first 2 years, that is 730 days in the first 2 years. And the development and growth occurs right at the time of conception.
Right,
so
of course.
What we actually want the mother to be ready when she conceives. And then the moment the child is conceived, the child needs proper nutrition.
Yes.
And the best part of nutrition in a healthy mother comes through her blood, which means she has to have folic acid,
right,
which will prevent many disorders of neural tube. And also, she has to have enough proteins, and she has to have enough iron in the later days to build the body.
Right. What about calcium?
And vitamin D. Calcium one would have from food. Now that's a myth.
Okay.
We always talk about calcium, but calcium is so abundant in the nature, we always have it. The only problem is calcium is carried in the blood through vitamin D. So we are deficient in vitamin D. So if the mother has enough vitamin D and iron and other minerals as well, and by minerals, when we talk of malnutrition, we talk of a hidden malnutrition. We give them calories, but we don't give them minerals or vitamins. So that is a hidden hunger. But once the baby gets it, and the moment, during those 9 months, proper antenatal visits are essential. Because we need to know that the baby is getting all the blood he needs or she needs. So once the baby is born, unfortunately, about 1/4 of our children are born underweight. And they're not because of term, they are because of undernutrition.
So the mom just doesn't have the resources.
The mom doesn't have the resources to hand over to the
grow
child.
a bigger, healthier baby.
Exactly. And the moment the baby is born, that is the second most important challenge we are facing now. That is breastfeeding.
Yes.
We want to breastfeed the children in 100% of the cases. Best countries probably are raising their kids with exclusive breastfeeding rates of about 80 to 90. In Pakistan, it's 37.
Wow.
And then, unfortunately, the initiation of feeding, that is where I always speak to my students and to my parents. The best time to intervene is the first milk the baby takes.
Yes.
The first baby has to be the colostrum.
Yeah. Yeah. And there's so many taboos around that as well, and a lot of bad myths.
And as we always say, well begun is half done. When we start breastfeeding in that way, then we continue it to 2 years. Otherwise, the mother leaves it in the first 2 or 3 months, and then the baby is on top feed, mostly buffalo or cow milk.
Oh gosh.
And let me tell you again, for the interest of those who have the money, all the packaged milks, all the formulas, they are all cow milks.
Oh gosh, then that's really not meant for children in
and it's not
any
meant for
case.
children.
Yeah.
Oh my goodness. So how does what are the sort of major symptoms of stunting? Because it's obviously something that happens over time. So it's not like you might have a low birth weight baby, but then the baby could catch up, But if it doesn't, I don't know, like, what does it look like?
So generally, it's a child who has got chronic, so long-term malnutrition. So a child who was maybe not appropriately fed at birth, didn't receive the appropriate meals at 6 months of age. So sometimes all you can have is a child who initially loses weight, and then you have a child who doesn't measure up with height either.
Okay.
And then, yes, these children are at higher risk of having serious infections. So they will be more prone to catch measles. If they catch measles, it will be more severe, chronic diarrhea. But sometimes physically, it may not be that obvious besides just looking at the height. But we do know that it affects their development, so the development of their brain. So it's a physical development and a development of the brain. So you have children who may be developmentally behind their peers.
Yes.
And these children grow up to be teenagers and members of society who then have intellectual incapacity or may not be productive members of society because they have never had that intellectual development.
So there are a lot of different aspects to stunting as well. So you might not
Absolutely.
necessarily be very short or extremely small, but you also have a lot of other things
Absolutely,
happening
yes.
around
What I
it.
believe is that if a child is, let's say, underweight, and even at 5, 8, 10, he's underweight and he gets proper nutrition, the weight actually then continues, then increases, and the child can gain enough weight. But the height doesn't come with it. So the height has to be, that's why we are talking about the first 1,000 days.
Yes.
The baby has to be around 50 centimeters at birth. So a child who does not have enough nutrition during the mother,
Yes.
he will
Won't
be
be
short.
50
Won't be
centimeters to
50
begin
centimeters
with.
To begin with. And then during the first 2 years, the child has to grow from 50 centimeters to 75 centimeters at the end of 1 year,
Yes.
and then to about 85 at the end of second year. Now, that doesn't happen. Now, if a child is, let's say, about 75 at the end of 2 years, this gap is never going to be filled. So this child
So
is
if
going
they
to
don't make it to that height,
exactly
by
the critical period is the first 2 years, including 9 months. And now, as Dr. Kakalia said, the most important thing is also the brain development.
Yes.
The brain development occurs during the first 18 months of life.
And doctors can measure this as well. So when you go for a checkup,
absolutely.
then a doctor can do certain, you can do tests and things to see
We don't
if
do
they're...
any tests.
Matlab, follow
The best thing is growth monitoring. We measure the weight, we measure the length, and we measure the head circumference.
Yes.
By measuring the weight, we know whether the child is malnourished or not. By measuring the length, we know how much has it affected. And then measuring the head circumference means, is the brain going enough?
Wow, that literally is the brain growing.
Yeah,
like your
exactly.
brain capacity is expanding as we go.
Exactly.
Oh, fascinating. I love science. We're going to take a very quick break and come back to this wonderful conversation. Stay with us. Hi, welcome back to the coffee table. We're having a really, really interesting and relevant conversation about stunting and malnutrition in Pakistan. And after all, we want what's best for our babies in Pakistan. The babies. So, we've been talking about malnutrition, and we've been talking about feeding kids, and that they have to have the right number of calories. So, what should one be feeding children? And then there's complementary feeding as well. So after you wean a baby, that still falls within those 1,000 days as well. Up till 2 years, you have to eat food also. So how should one sort of begin? So let's say if a mom is breastfeeding and then also giving formula, and so what should this sort of plan be?
So I think that the plan should be, once the baby is born, to begin breast milk. Breast milk is, in a poor country, breast milk is also it's economical. It's the best milk for the baby. And I think there should be a lot of focus on maybe educating or empowering women and empowering hospitals and midwives to begin that first feed within 1 hour of birth. To really begin that. And those are the women who've given that first feed, that rich milk that comes out. And they are the ones more likely to continue breastfeeding. But our local statistics show that only 20% of women actually feed within the first hour of delivering.
Wow. And then this across background and across sort of economic
So it does differ amongst economic, but generally it's patchy through, the first feed. And otherwise, breastfeeding for the first 6 months is enough food. That's what the child needs. And as Dr. Saab said, the maternal nutrition has to be maintained at the same time, because it's the mother producing the milk. And women need to be educated that this milk contains all the nutrients that the child needs. And then at 6 months, that's time for the child to need complementary food. So breastfeeding should continue for 2 years. And with complementary foods, there are 7 food groups that the WHO makes, which have, dairy is one, grains is one, legumes, what they call flesh food, which is our proteins, and then different varieties of fruits and vegetables.
Sounds so zombie-ish,
So like the yellow fruits and vegetables are rich in vitamin A, so that's a separate group.
Yeah.
And out of these 7 groups, children should be receiving at least 4 of these every day. So the quantity of food is one aspect. Certainly, there's a lot of food insecurity.
Yes.
So quantity is one. And the other is also the quality. So being able to give foods from these 4 diverse groups. And it's actually very few children. It's about 20% children in that critical age group up to 2 years who are actually receiving the optimal diversity of foods, so that they're getting all the micronutrients and all the little things that they need for optimal development. And these are not expensive foods.
That's what I was wondering about. Do you think that that's because of economic necessity that children aren't receiving certain foods, or it's because there's just a sort of lack of awareness on what's appropriate to be feeding children?
So part of it might certainly be the economic needs. We are not a rich country, but as I said, breastfeeding doesn't cost anything. And formula is extremely expensive, which a lot of people do opt to do instead of breastfeeding. So if you have a poor woman who quits breastfeeding at 2 months, she has a child, she's giving formula to, or buffalo's milk or cow's milk, which she's diluting with dubious water, which may not be boiled. And the child now comes in with diarrhea and recurrent infections. Now you're stuck with a 7-month-old child who cannot breastfeed now, and economically very expensive milk. But there's a lot of advertising about how formula milk is good for babies' brain development, and a lot of commercially available foods that are also touted as being extra good for a child.
Yes.
So I think part of it is economic necessity, and part of it maybe just lack of education and awareness.
Making things easy, the child is learning to eat food between the ages of 6 months and a year.
Right.
And at that time, the staple diet is still the milk. Because we expect that at the age of 1 year, still half of the calories are going through the milk. And supposedly, milk contains all these 7 essential groups.
Yes.
The nutrients from all those.
Okay.
So, except for probably it doesn't contain enough iron, but rest of the things it does contain. So, during that time, you can experiment with the food at your home. Now, there is a very important thing is that you have to give the food that you eat at home.
Okay.
So, you do not have to have a special commercial formula of complementary food. You do not have to have something which is written in the cookbook.
Yes.
The best thing is, whatever you are eating, just take out a portion, make it softer, make it easier for the child to digest, and give it. We definitely do not want to add meats before the child is 8 months of age, and we do not want to add egg before 1 year of age.
And wheat also, I think it's after 9 months.
No, wheat we can start at 6.
Okay.
There's no need to stop milk. The wheat. The best thing is that we start from rice cereal, which is properly available. We use a lot of rice at home, and we can use bananas and yogurt. These are the things which are always present. I feel that by giving this and not actually concentrating on the 7 foods during the first 1 year, because this is the time that the child is learning to eat. So we give them, the child has a tendency towards sweet food or has a tendency towards saltish food, but that's okay.
That's all right.
And by the age of...
But as long as the sort of calorie intake that's happening for a child is coming from the least possible, the least processed kind of calorie is the best one
and
for a
probably
child.
the easiest for the mother to make. And by the age of 1, the child is ready to chew.
Right.
And that is the time when we try and switch to the table food.
Yes.
We expect that during the 2nd year, the child should be taking the table food that the adults are taking, with some help from the and a little bit of breast milk and a little bit of the milk, the food prepared for them.
Which makes life much easier for everybody involved. Now,
and it is not costly at all.
Quite right. Now, Dr. Kakalia, you mentioned dubious water, and that's why I want to sort of now steer this conversation, is that a lot of stunting, shocking numbers of stunting, and I wrote it down, 54% of stunting is apparently due to poor sanitation. And I'm sort of shocked that open defecation, which doesn't seem like such a massive problem, where it's like, okay, sort of go out into, you don't have, so a lack of proper sanitation leads to stunting. So could you sort of explain why that is?
So besides a lack of calories or inadequate nutrition leading to malnutrition, any infection that you get is also going to put you on the back foot. So basically, it's going to make your immune system weaker. So if you have diarrhea, it's going to make a malnourished child more malnourished. And that vicious cycle is going to continue. So one of the things that a child needs besides nutrition is what every human being needs is clean water. So if you don't have clean water, so water that is contaminated with viruses and bacteria, then the child will have worm infestation, the child can have repeated episodes of diarrhea, which make the child more weak and more malnourished.
Okay.
So one of the things that lead to poor water is poor water supply or poor sanitation. So open defecation in places that are far close to water supplies, or even if it is not human defecation, if it's animal defecation near open supplies and the child is drinking untreated water from that, then you will give rise to worm infestation and diarrheal diseases, which do certainly add to that cycle of stunting.
Wow, and I think that there's a lot of work been done with the support of DFID and UNICEF and things that in areas where they have been able to sort of install better toilet facilities, kids' nutrition has sort of the stunting has decreased in places with better hygiene practices have been implemented. I think my grammar is just going to pot now because
exactly what she
I'm
said.
just so sort of caught up in this idea that it's not even that difficult. So it sort of kind of boils down to
I am a little skeptic.
clean water.
I am a little
really?
skeptic.
Yeah.
Why do we need international aid when we are talking about our own kids?
Well, money is helpful.
Because we spend all the money on the larger hospitals. If I'm talking about health, we have just 1% per capita income spending on health.
Yeah.
Whereas we need at least 10 to 15%. So, okay, we are short of money. We have that 1%. Why is it being spent on tertiary care hospitals mostly?
Yes.
Why do we wait for WHO and DFID and Asian Development Bank to help us in the primary health care, which is probably much cheaper, and divert our own funds to the tertiary care or to non-developmental budgets?
Right. It's true. And the thing is, if children under 5 are dying from diarrhea and are getting stunted or wasting, then they're not going to make it to tertiary care in any case.
And even if they make it to the tertiary care, there is a higher incidence of death or disability there. So it is better to nip the evil in the bud. So as Dr. Kakalia said, that it is basically a vicious circle. A child is already malnourished and he gets repeated infections.
Yes.
And repeated infections come from unboiled water. It comes from unboiled utensils, including the bottles that the child is taking. It comes from the water mixed with the sewage and causing a lot of infections. So the child gets more infections. The already reserves are low and they run out, and the child, and I describe it very easily in terms of cricket now, there is cricket fever. Any team will have better average if there are no wickets falling. So every time a wicket falls, the average goes down. So every time a child gets sick, the average goes down. So the child enters into that cycle of malnutrition.
So malnutrition is also linked to wasting. And I was looking at the National Nutrition Survey in 2018, it was published, and it said that 2 in 10 kids under 5 are also suffering from wasting. What's wasting?
Wasting is, as I mentioned in the beginning, wasting is when the child is not getting enough calories and the child weight for age is below the 3rd percentile.
Oh,
so, which is pretty common. And when we are talking, well, actually, the incidence of mild malnutrition is close to 40-45% again. And this wasting that you're talking about, 20%, is moderate to severe undernutrition in that respect.
Okay.
And this, as I said, when continued over time, leads to a lot of stunting.
So I think if I may, wasting is when you have acute malnutrition. So you've had it for a short amount of time, the child becomes skinny. You become thin, your weight drops. That is reversible.
Okay.
You give enough calories, you can expand that again. Goes over a long period of time, now your height begins to suffer as well. And if you haven't corrected that before 2 years of age, now you have a child who is stunted. So stunting, if you may, is Not quite, but simplistically a continuum of wasting, something that's happened over a long period of time.
So it's sort of like the spectrum of malnutrition, the wasting is sort of in the middle. And then, like you said, once you're stunted, then that's just game over for you. And then there are a lot of other things that happen when one is stunted or suffering from stunting. And there is apparently a link between birth intervals also and the sort of birth average as well. I'm not very clear about it, so I'm hoping that you can explain. Because a stunted mother who has too many children too close together, the sort of incidence of them being stunted is also higher then.
So I think if we look at that very simplistically, so a mother who herself has started off, maybe herself being undernourished herself, is having too many pregnancies, too close together, too many children. So the economic necessity of it, the stress that the body is going through, I think it is only natural that she's more likely to have stunted children or children who will maybe be born low birth weight, so already at a disadvantage, and then receive more disadvantage over those first crucial 2 years.
And there's also increased mortality, well, obviously, and there's also increased morbidity. What's that? What's morbidity?
So morbidity is when you don't die, mortality is when you die of something, but somebody who is stunted generally, unless they get a severe infection, generally doesn't die of it. So it's not a disease per se. But that stunted child is now, morbidity will mean it's really the brain development, decrease in that development. So you end up as someone who's developmentally challenged, maybe with less intellect. So that is your morbidity.
Oh, so it's basically like a massive hit to quality of life, really.
Quality of life, and also being a contributing society, member of society. So you're raising citizens of the country who are going to grow up with, with this kind of insult already having happened.
Yeah, and that's then a direct economic cost that we face as well, because then those children grow up to be your workforce, and then that's a compromised workforce that can't really operate at the same level as other people who, are healthier can. We're going to take a very quick break and come back to this, so stay with us. Hi, welcome back to the coffee table. We're still talking about stunting and malnutrition and what can we do to have healthier, better practices for our children. And it's not just children as a general, but stunting is something that is much more prevalent in poorer areas, to be quite blunt about it. This is not a disease that happens to quote-unquote rich kids. So is this why we don't really know so much about stunting? Because it's just not happening where we notice it that much.
So absolutely, stunting is much more in rural areas. It's more in poor people, and it's the mothers who are stunted, who are giving birth to these children. So it's not really on the radar. And I think that stunting, we don't talk about it as much because children are not dying of stunting per se. And these are children in rural areas, in small villages, away from the general. And if I may say a little anecdote, I visited small villages in the Indus Delta a few months ago. And I asked people over there was a small BHU there, and I said, what do your children have? What diseases do you have? They said, our children have a lot of diarrhea. And I asked what water they're drinking. And they said, well, we don't have much water. A lot of the Indus Delta is dry. And there were pools of water in which there were animals, wild dogs, and a lot of it was just drought. And they said, well, the animals drink from this water. This is the only water we have, and this is what we drink. And they were aware that this can cause disease, but they don't have a choice. And I was pleased to see lots of outdoor toilets. So they had been informed that outdoor sanitation was required, and they were quite nice and spanking clean blue toilets. And they said, well, the women and children use them, and sometimes we save them for the guests.
Oh, but what about the men? The men are still doing without.
So I think that, I think something's being done. Somebody's building the toilets. I haven't been there and built them. So I think, kudos to the people who are doing that and who are increasing this education. But it's a deep pit, and yes, it's a poor disease. It's a poor illness. And people need clean water. People need food. Women need to be empowered. We just had International Women's Day, and women need to be empowered and taught that your milk is fine. There are no myths. Your milk is not bad. Do not give in to buying dabbe ka doodh. Breastfeed your child. Start as soon as your child is born. And, I think starting with that and knowing that they can give table food, they can give, sabzi, dal, roti. How expensive is that?
Yes. And if one is eating...
The irony is that she just mentioned that stunting or malnutrition is extremely prevalent in rural areas.
Yes.
Now, these are the areas which produce food. Now, the main cause is they are ill-informed. There is lack of education and there is lack of awareness of good food versus bad food. So whenever they do have some money, they're going to spend it on junk, which is just simple calories and not enough nutrition.
But junk makes you fat, and then you feel like maybe if you're fat, you must be healthy.
Junk actually doesn't make you fat. The junk, which is the crisps and the cokes and the juices, the so-called juices, which are actually fruit
Sugar,
drinks.
water.
So they give you satiety for a moment, but the child doesn't get enough food. Now, the problem in the rural areas and in the semi-urban, and especially it is worse in the neo-urbanization, where the people are moving from the rural areas to the cities and they are living in the slums, where the sanitation is extremely bad, the food quality is extremely bad, and they don't have sunlight, they don't have play areas. The child doesn't actually have resources to run around, or maybe, all of these factors go against the child. So it is at that area that we need to increase awareness. That we have to go through the schools, there we have to go through the madrasas, there we have to go through the religious cleric, and we need to inform them through the television and the mainstream media and the social media. Unfortunately, the media portrays more of advertisements from the junk food makers and from the milk producers and from those, so which is quite against what actually the child needs. So we feel that media has a very important role to play, and as well as we have to make programs to inform the people through the local areas where they can get information. So it is more a lack of information which is causing. And let me tell you, when our Prime Minister, when he took over, and in the first speech, he talks about stunting. And he shows those pictures where he shows that stunting causes brain development retardation. Now, that is extremely important, which means that the government is cognizant of this. But how to handle it? Now, it needs more support, and it needs support not only from the clerics, it doesn't need support from the experts, it needs support from everybody. And I would suggest that media should play a role, and I think in that respect, I appreciate you bringing up this topic in here.
Thank you.
So that we are actually talking about it.
Yes, quite right, I think. And again, it's a matter of structural reform then, really. And like you said, we can't really be just looking at tertiary healthcare, for example, but we need to really be on the ground to talk about this. And when I was reading up about this, maternal and paternal schooling levels also impact child rearing practices as well, which seems fairly obvious. But what are sort of then child rearing practices would include things like what you're feeding your baby, and are you nursing your baby, things like that.
Absolutely. Do you have enough literacy level to be able to understand these concepts, and are you aware of these concepts?
Yeah, being aware. I think, and that's maybe where we can sort of mobilize, like lady health workers who do go from door to door to kind of talk about this. Some kind of curriculum that can be
It's already in their curriculum.
There is, okay.
It is, and they do talk about it. The unfortunate thing is, whenever any person from the government goes, people don't listen.
Really?
That's very unfortunate. And usually it is the grannies, the grandmothers, the grandfathers, and the community, which in the first sign, whenever the mother has the first problem, they'll say, stop breastfeeding.
Really?
So the mother doesn't get support for breastfeeding. The mother, even if she wants to give good food to the baby, the elders would take the child along and give them the junk food. So it happens everywhere. So it is overall community understanding which is required, and not just about stunting, it's about nutrition. So good nutrition, good prevention, hand washing. Hand washing is extremely, so especially after defecation, because there is still more than, I think 70% people still go out to defecate and they don't wash hands.
Because, where's the water?
So, and even if they have the water, they have not been taught to do it. So hand washing after defecation, hand washing before eating anything. And then washing the fruits, washing the food, and keeping good hygiene is essential.
And we're also dealing with a kind of cultural imperative here, where I also imagine that, but before I get into that, are boys more stunted than girls, or do you think it's just a fairly sort of even ratio?
It's relatively an even ratio, even though we do hear anecdotally that the girl child is fed less, but with stunting, we haven't seen a difference in numbers.
Okay, that's interesting, because that's where I was kind of going with that. Is that because cultural imperatives as well, that girls don't get fed as much as boys do, or they get fed sort of poorer quality food than boys are? And then that's also something that can contribute to this sort of general malnutrition.
So the National Demographic Survey, they do a survey every 5 years with details of this. So the gender parity is there.
So Dr. Zafar, what else can we do to sort of increase awareness with this? Because it's predominantly a rural problem, but it's also, like you mentioned, happening in urban areas as well, where you have low-income neighborhoods, where children don't have access to a lot of facilities that they do need to be healthy.
Let me give you an example of Pehchan's Mother and Child Health Promotion Center. Now, this is located just adjacent to Defence, walking distance from the Eden, in a village, Malikpur village, which probably could have been part of Defence, but for some reason it is not. Now, the villagers there who are living usually thrive because their women and men folk go and work in the defence areas. And these are among the lower socioeconomic conditions. We have all the bad sanitation there. We have garbage heaps there. We have open defecation there. We have no access to good water over there. And the worst part is their children run across the road and see big cars. So what are they learning? So we have started an initiative, and we have actually, during the past 6 months, we have done a household survey of all the houses, and we have got their need assessments. We are working with the community, and we have got the religious leader, the Imam Masjid on board. So give sermons on Friday. And we are providing them with vaccinations and with growth monitoring and the nutrition advice at every visit. They don't have any health facility for 4 kilometers. So just living there.
Well, and this is a very urban space. It's not some sort of far away village with no electricity and nothing.
Walking distance from Defence.
Goodness.
And because of its location, it doesn't have any health center around. So what we are not only providing them with the secondary care, which is the doctor sitting there and giving medication, but we are providing the community mobilizer, goes to each and every house and tells them and looks after their problems.
So what's the response been like? Because I can't imagine that parents would be reluctant to want to feed their children, while of course every parent wants to do that.
The response is good. As far as the willingness is there, but then the resources,
of course,
and also because of taboos and because of problems. Again, as I said, the grannies and the others who are reluctant to change their ways. So that is a big obstacle right now. But we are working on it. How we want to do it, we have taken the first household survey. What we want to do is scientifically prove that over 2 years, what difference have we made? And then we make it public so that now, and if you remember, the government of Punjab is now moving to mother and child health hospitals, mother and child health centers rather than the tertiary care. So that's a very good initiative and we must appreciate it.
Yes, quite right.
So these are the things that if the government is doing it, if the non-government agencies are supporting it, if the international agencies are supporting it, it's all fine. All we need to do is put our weight to it, create more awareness, and let the people know that these things are ultimately going to help through our data and through our research.
I think, whenever you have numbers, then the enormity of it can be explained, I think, in a much more concrete way. Because do you think that, it would be a thing also where maybe some households would be like, well, it's not such a big deal. Child seems fine. So it's okay. Seems all right to me. It's like doctors are just overreacting.
So I think that, convincing a parent that this is a problem, I think, telling them what the future would be like. And, I think I appreciate what Dr. Zafar said about the grannies, and maybe we need to get the grannies on our pediatric workforce.
And the grandpas. And I think you mentioned also something to me in the break where you were not listening about lady health workers who can dispense, micronutrients to kiddos who need it.
So I think what I was alluding to was that there has been a lot done on this.
Yeah.
And, 38% is a horrific number. But this was from the survey of 2017, 2018, and 2012, we had 44%. So there has been some improvement, and let's have hope for the future. So lady health workers do go door to door. And there have been many initiatives, each government, foreign initiative, local initiative, so micronutrients have been given in the past. There have been some school nutrition programs.
Okay.
But all of these have been patchy, especially when foreign donors come in, they come in, we come in for a little while, do something, and there has to be something more sustained. That it's not a Band-Aid. These are just a Band-Aid, giving micronutrients, doing a study on it, showing that it's improved, and then the initiative falls apart. So there needs to be something more sustained, and I think something much more grassroots, just getting the community to take care of their own problems.
Yeah.
This is a problem of your community. How are you going to address it?
And for the better future of all the kiddos involved. Absolutely. Thank you so much, both of you, for being on the show. This is an extremely important and very informative conversation, and I'm just like, whoa, science, I've learned so much. Thank you guys for watching this. If you're watching this on YouTube, don't forget to like and subscribe. Talk to the people around you about stunting. You never know who needs help and who needs to see this program, and do your bit in raising some awareness about this very serious problem, because we are really talking about the future of all our children, and they are all very important to us. So once again, thank you guys for watching. We will see you next time on the coffee table. Bye now.